What would you think about a craftsman working in 2024? He has tons of experience and he has amazing set of skills and he's producing a magnificent work. But he's still using the same techniques he used to use 20 years ago and he's not open to new technology, new stuff about it. I think most of us during this process of getting a license to be dentist again in Canada here, doing the same problem, because we think the way of studying we did during our dentistry college back home, it can make us go through this process, which yes, it can get you through. But why don't you be smarter to study smarter, not harder, so to save time and make the best of your limited time? So today I'm going to introduce to you artificial intelligence in dentistry. I know this is like, I cannot say it's a new technology, it's almost 2 years now, but I think no one before did use this one because it has a lot of obstacles. It took me almost 9 months till I finally see something like it's really beautiful. Like I love it so much. Once you see it now, you will see it. So you will have a study partner in your pocket. This study partner is here for you. He can explain to you, he can study with you, even he can give you games, matching games. This is the one I love. He can give you condensed note. He can give you comparison between the major key points. It's really amazing. Let's see it. So this is the website. It's called Quizlet. Once you enroll in our course, I will give you access to this class. This class include this folder, which has all the material. So I did divide the materials to be like, as you can see here, chapter 1, first to be study guide, which is the notes, and second to be a practice test. And we have up till number 10, where we have finally, I think, the diabetes mellitus, and finally we have study set, which is almost 200 card with all the medication, with the name of it, and the way of acting of these medication. So let me give you example about how it's really nice. Let me show you how it really works. Okay, let's start with this cardiovascular system. So once you go to study guide, he will give you this beautiful summary of the chapter. So from where this summary is coming, so I did myself handcrafted notes from textbook. So I go to textbook, open 2 or 3 textbook, which is reference list from NDEB, and then I extracted the information which is clinically relevant for us as a dentist and highly yield in AFK exam. After I did it, I give this to the ChatGPT here, which he will give you more, even condensed information. You see here is giving you more information. It's coming to the action, like propranolol, action, therapeutic use, adverse action, prazosin, action, indication, nadolol. So it's giving you this. Moreover, if you go here to this quick reference, it even here give you some comparison. Captopril, losartan, propranolol, furosemide, digoxin, class, indication. And then moving forward again to the fact to memorize here, like he's using the intelligence of the artificial intelligence to make it even more refined to give you the specific point you need to go through. Stable angina, unstable angina, and as you go. So let me show you the different part, which is like a Q chat. See this one, I love it so much. So this Q chat has 4 modes. First one is teach me. So in teach me, he is going to explain to you. Let's read together. Welcome to fascinating world of cardiovascular health. Here we will explore essential terms related to heart function, hypertension, and medication. So here he's giving you like a head for everything he's going to start with you. So let's start with unstable angina. So now he will give some information, then ask you a question, and then you move forward. This condition is characterized by increased frequency, duration, and intensity of chest pain compared to stable angina, which can occur even at rest and may signal an impending heart attack. For example, if someone experiences chest pain that lasts longer and happen more often than usual, they may be experiencing unstable angina. Fun question. If someone feels chest pain that suddenly become more severe and occur without any physical exertion, what condition might this be experiencing? So here I think it will be unstable angina. Let's see. Right, okay. Unstable angina is characterized by sudden and more severe chest pain. Let's move to the next topic, loop diuretics, and then he will move to with you. So this is your first time studying. So what happened if you give wrong answer? So let's read the next question and give wrong answer. For example, a patient with heart failure may be prescribed a loop diuretics to reduce swelling and improve breathing. What is the primary purpose of loop diuretics in heart failure treatment? So let's see, to reduce the pain. Like given the wrong answer, let's see what's going to happen. That's a good attempt, but like he's trying to be Canadian here. But the primary purpose of loop diuretics is not to reduce pain. Instead, they are used to relieve volume overload by increasing urine production, which help eliminate excess fluid from the body. Think about how they help with symptoms related to fluid retention. What do loop diuretics help to alleviate heart failure patient? So again, he is explaining in a polite way and then asking you, okay? So let's give him the good answer here. Reduce the volume and see. That's correct. Loop diuretics help to reduce volume overload in the heart failure. And then he will go with you again. So this is after your first time. You would like just to recap, see he's coming to you, so easy. Now let's make it a little difficult. Quiz me. What is the mechanism of action of digoxin? So digoxin is affecting the calcium, I think calcium entrance to the muscle cell to make it contract harder. You are on the right track by monitoring calcium and muscle contraction. However, the specific mechanism of digoxin is to inhibit, and here giving you the specific mechanism, inhibit sodium, potassium ATPase, which increase intracellular calcium level, enhancing contractility. And then moving forward, what's stable angina? Pain in the chest can be controlled with nitroglycerin. Correct. Stable angina is characterized by short-lasting chest pain due to reduced coronary perfusion, can be relieved at rest. What are the adverse action of alpha-1 blocker? This is prazosin medication, hypotension. Partially correct. Adverse effect of alpha blocker include orthostatic hypotension, dizziness. Hypotension has significant effect, but it's important to specify orthostatic nature. So here he's giving you even the specific answer. It's not like this. No, he's giving you the answer. Let's move to the third mode of studying, apply my knowledge. Now he's asking you a question. How does spironolactan's mechanism of action as aldosterone receptor antagonist contribute to its use in treating heart failure? Please provide your answer and I will grade it. So now he's asking about the spironolactan mechanism of action in treating heart failure. So it reduces the volume of fluid inside the body, which will reduce the overload over the heart. And let's see. The answer is correct. Act on an aldosterone receptor antagonist, which lead to increased sodium and water excretion, thereby reducing fluid overload. So you see here the question, I didn't know this question before. And this is really the lovely part about this one. Every time you open it, it gives you a new question. Every time you open this tool, it will give you a new question. You see now I'm a little confused about the question. I'm giving vague answer. Why I'm giving vague answer? Because I would like you to see it's not like other tools giving the vague answer. Why? This is different because this has been fed with accurate information. When you give AI accurate information, it will give you accurate answer. So let me ask him a question now. It's my turn now. So what is the difference between ACE inhibitors and, sorry for my grammar, ACE inhibitors and ARBs? Let's see. ACE inhibitor and ARBs, angiotensin II receptor blocker, both help manage hypertension and heart failure, but they work in a slightly different way. ACE inhibitor, like captopril, block the enzyme that convert angiotensin I to angiotensin 2 leads to vasodilation and decrease blood pressure. On the other hand, ARBs directly block receptors that antagonize 2 bind to preventing its effect. This can lead to fewer side effects such as coughing, which are more common with ACE inhibitor. Would you like to ask anything else? You see now, so even when after you study, you feel like I don't know the difference between ACE and ARBs, so how he can explain the difference for me? And here I intend to give it like in short, ACE and ARBs, so he can like give you the answer. So why lithium cannot be used for renal failure? Sorry for my mistakes, patients. Lithium is primarily eliminated by the kidney, so in patients with renal failure, the drug can accumulate to toxic level, potentially leading to serious side effects. It can also worsen kidney function further. Monitoring renal function is crucial when prescribing lithium, but in cases of significant renal impairment, alternative treatment are usually recommended. Do you have more questions about this topic? Why? Okay, so let's discard the lithium topic. So as you can see here, I did a study. Buy it with it. Teach me, and then quiz me, and then apply my knowledge, and then ask question. So let's go to the time of playing. Yeah, I love this one so much. Match. Again, all the question you are going to see now, I didn't see before. So every time you open this one, it gives you a new question. So here, this one, discard the timer here. It's really driving me crazy. But anyway, he giving you here some cards, and then you should match it. So furosemide is a diuretic. So let's read it. Rope diuretic used to treat hypertension and edema. Correct. Stage 1 hypertension. So speaking about numbers, let's see. Systolic 130, 139. Correct. Transport blood with oxygen, nutrient, and hormone from the heart to the rest of the body. So speak about circulation. Circulations here. Digoxin therapy lead to increased heart rate and stroke volume? No. Stable angina. Digoxin for heart failure. Yes. Stable angina. Short lasting. Yes. Vascular resistance decrease lead to increased heart rate, stroke volume. See, this is like, it's really funny. I love it, honestly. And then you can play again. The questions part. So here in the same set, we said we have one for the notes and one for the questions. So this is a question, practice test. So now after you study everything, you want like to test yourself. So here I will make it only 5 questions to make it like, or 10 questions. Let's see together. Again, every time he's giving you new questions. See here, this was my score before. Here he will give me a new questions here. Which of the following best describe process of drug absorption? Which of the following best describe the process of drug elimination? More active? No. Into absorption, the binding. Removal of drug and their metabolites. Which one of the following is the most common route of drug administration? For sure, oral. What does pharmacokinetics focus on drug study? Dynamics, movement, absorption, does to the body, or the other way around? I believe does. I hope I am correct. What does the term bioavailability indicate in pharmacokinetics? Friction of the administered drug that reaches stomach circulation. Or yes, half-life, no. Movement of drug throughout the body, no absorption. Elimination, this elimination. Here again. So you see here, this is the question, and let me just give any answer. And then see at the end, submit test. So he will give here me, whoa, amazing. So he will give you here the score, give you the correct answer, and then you can study more. And then you can retake the test again. Or take a new test. I will give you another 2 questions, 10 questions of it. And then moving forward. So this is why I think this tool is really amazing, because us as a dentist, usually we don't use such tools in our study. We think the way we study before is enough. Yes, it can be enough. I'm not saying you must use these tools. No, it can be enough. But trust me, these tools, like, it will make it easier. Think about it as study buddy. He is available for you all the time. So I will give everybody access for this study set or everything about it for pharmacology. Now it's only pharmacology. I have other study set for each topic, like we have for LA, for management, for pathology, but I will give access for this one for the next 10 days. And if you love it, if you wanna join it, so you can join our course. In our course, we have everything I discussed before. So we have live lectures, we have interactive lecture you can watch at your convenience. We have one-to-one session, and by the end of the course, I will provide you with 4 mocks, and then 10 mini mocks, including 1,000 exam questions, so you can study more, you can craft your knowledge, you can test yourself and get the feel, okay, I'm ready to go to my exam now. No, I need to push it again. And as the course started, now we are in the 4th week, 3 weeks are gone. I will give a discount of 500 Canadian dollars over the price of the course. And this discount will be valid till the end of current month, end of September. Starting from October, the price will go back to the original price, just to help you, because I know the course did start already, but this tools was in process of making. I didn't finalize everything in the last few weeks. I was like, let's make it like beautiful, let's make it beneficial before release it. And we have payment plan. If you decide to join, you will pay 1,000 now and 500, and then 500 the following month. Hope that was beautiful, a test for you, and please just try it. I'm not asking you to join the course now, Joe. Just try it for the next 10 days and see the notes, see the comparison. It's really beautiful. Like, I love it. When I was studying, I used to love Quizlet so much. So thank you very much for watching till the end, and hope to hear from you soon.